Hello, and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Today, I have Kimberly Setzer from Caldwell Hospice and Palliative Care. Welcome, Kimberly.
Thank you for having me again.
Kimberly, we're going to talk about something, an event. Well, it's not really an event. It's a resource that you have access to, I guess is the best way to describe it. In the past, it's been an event. Your Living with Grief series, and this topic is so relevant. Living with grief since COVID-19. Tell us a little bit about this program.
Okay, so this is part of our annual teleconference that we do through the Hospice Foundation of America. Typically, we're all together and do this. It's a continuing education event, but of course, like many things this year, it's going to be virtual. So it's on demand. But it's really talking a lot about how all of us have had to live a very different life for many reasons. All of us have been impacted by COVID-19 and just living with grief related to COVID-19, whether it be you've lost someone, you're aware of all the community losses, or you haven't experienced the death of someone close to you, but your life has changed because of the COVID restrictions. We're just talking about living with grief because of all those changes.
And there have been so many changes for all of us. And when I'm talking with people from hospice, I think about how your care hasn't changed, but some of the tools you use have changed. Talk to me a little bit about that.
Yeah, so just like everyone else, we've had to abide by physical distancing and wearing the PPE. And so what we do hasn't changed, but how we deliver those services has had to change to be in accordance with those restrictions. And so we've done a lot of virtual visits. We've been very strategic with who goes into homes and when they're going and how they're going in, being sure that we have the PPE in place to protect our patients and their families and our staff, our long-term care partners, any of our clients. And so just being responsible in our community has been a huge part of how we've delivered services the last year.
And before we started taping, we were talking, and you have put together a grief and COVID program. What are some of the things you shared during that program?
Some of the things that we talked about in that program and that educational opportunity are very similar to what's going to be covered in this. We talk a lot about how grief is not just related to the death of someone. Grief is a response that we have to any major life change. So one thing that comes to mind is children have not been able to go to school. And so that is their routine, that's their socialization, that's their normal learning environment. And so a lot of children have been doing virtual learning. That's been a huge adjustment for the students, the teachers, the parents, caregivers. That's just been a dramatic change. And so there's certainly a level of grief with that. Children have not been able to see the other members of their cohort. They haven't been able to see their teachers, haven't been able to see the assistants or the folks that work in the cafeteria or drive their school bus. And so there's certainly an element of grief anytime our routine, our exposure to those people that are part of our everyday life, whether it be school or work, our clients. We grieve whenever we don't get to see folks. I think about our larger community. You know, for a long time we weren't able to have sporting events or outside activities. We weren't able to gather together in places of worship. And so we've really grieved that togetherness and that sense of community. And then, of course, there have been just an astronomical number of deaths related to COVID. Some are not related to COVID. But we have just been inundated with talk of death and loss, grief. And so all of us, I think, over the last year have felt really overwhelmed with that. And it's different grief, so we're not real sure what to do with it. And gaining an understanding on that can be really powerful.
It can be. And you mentioned students, but I think about healthcare workers because their role has changed. Maybe it hasn't changed, but it's certainly been different.
Absolutely.
And you've already said at hospice, a lot of the ways you provide services have been different. How has your staff, how have you seen other healthcare workers deal with COVID and the stressors?
Well, it's been a huge challenge for everyone. A lot of people in healthcare, especially frontline healthcare workers, have been working extra long shifts. They're doing that in a lot of PPE. And so, we think about, for example, when folks were in the dying process, and we think about the folks who were able to be at the bedside, whether that be the nurses, their CNAs, the doctors, they were very restricted visually to the patients in all the PPE. And so we think about ways to be creative and make sure that patients feel supported and have that awareness that people are with them. We still hold hands, it's just with gloves on. We still talk to people, we just have to speak up because we're speaking through a mask and maybe through a shield. And so you just have to get really creative in how to take care of your patients and those that you serve. But it's been a challenge to work in that environment day after day in many healthcare settings. I would say probably in all healthcare settings. It's just whenever you go into the healthcare or helping fields, it's because you have a passion to serve other people. And anytime there's a new or different barrier to that, it's a challenge. But you get creative and you work together and you support one another. You take care of each other. You have time to talk about it and debrief with it. I think about especially our emergency care workers and our ICU workers. They've really pulled some long, hard shifts over the last year, and having time for them to debrief from all that. And also just being very intentional to encourage people to engage in self-care when they're not at work. We've had to get really creative with that too. A lot of the ways that we participate in self-care, whether it be exercise at a gym or going on vacation or spending time with family, a lot of that's been restricted as well. And so we've all had to get really creative. And I think at the end of the day, we've all learned a lot about ourselves. What works, what doesn't work, why we do things. I know a lot of us have talked at Hospice about how we've, throughout this horrible experience, some benefit and some good of that is we've really reevaluated who we are as individuals and what's important to us and maybe what's not important, and just had the opportunity to kind of reset and be able to identify our priorities as individuals, as a team together at Hospice, as an organization. But I think sometimes on a community level, we've been able to do that too.
And with this teleconference, what are some of the things that people will walk away with?
Well, I think you're going to walk away, most importantly, being validated. I think it's really hard to feel validated when everyone's overwhelmed and everyone's stressed. But I think that the information and the content in this teleconference really focuses on it has been a stressful year. It's been a hard year. When I was thinking about this and kind of preparing for this, I started thinking about all the things that have changed for us. And that list could go on for days. It would be much easier to make a list of things that haven't changed. COVID, in some way, shape, or form, has impacted every single part of our lives. And so to carry that stress and that burden for a year, over a year now, is exhausting. And I hear people all the time say, I'm so tired, I don't know why I'm so tired. And it's because we're running on a high stress all the time. And you can't do that forever. I think it's important to be validated in that. I think sometimes we think, well, what's wrong with me, or am I not okay? But it's really the circumstances that we're dealing with right now. I think it's important to be validated. That alone is very powerful for people and helps people say, okay, so this makes sense. I'm not overreacting. I think it's also important to recognize what all has changed and why that contributes to being so overwhelming. So if I was a person who went to work Monday through Friday, 8 to 5, dropped my kids off at school, we went out to dinner 1 or 2 nights a week, and all of that went away suddenly, unexpectedly, with really no time to prepare for that, those are all very high stress changes alone, but when they all come at one time is really difficult for people to deal with. I think it's also really important to recognize, and it's outlined very well in this program, the differences between non-death and death losses and how they can impact our life. I think it's also important to recognize that even if you've not had someone personally very close to you to die of COVID, we're all grieving because there's been so many people in our community, in our state, in our country, and worldwide. And you know, we kind of went from in 2019 to talking about death and dying and grief and loss kind of being taboo. We didn't really talk about it a whole lot. We engaged in that conversation when we had to, when we were forced to, or if that's our job. We went from that to that's all we've talked about for a year. And so that's a huge transition. And so we're a little overwhelmed with talking about death and dying and grief and loss. But it's important to recognize grief, the grief process, the task of mourning, all that's outlined in this, how to cope with losses, whether they be non-death or death losses. The other thing that it really talks about is complicated grief and how so many people have experienced some non-death losses, some death losses. A lot of people, unfortunately, have had multiple losses. We know that there's been couples who have passed very close together. We know that there's been families, unfortunately, where they contracted COVID and they all passed within a relatively short period of time. There's been faith congregations where they've had multiple losses, long-term care communities. There's been a lot of subsets of communities within our larger community that have had tremendous loss. And so recognizing that multiple losses are very difficult, as well as multiple losses being non-death and death losses are also challenging. Just giving an understanding of why people are struggling, I think, helps a lot. And then, of course, there's some good information of how to cope with all this and ways to identify self-care options and coping skills and ways to help you figure out what works for you as an individual. So what works for you most likely is not going to work for me.
Right.
Other really good thing to remember is that when in talking of self-care or coping skills, something that's worked for me in the past in a different circumstance may or may not work for me now. So if you're one who hasn't had a lot of loss in your life or hasn't had a lot of change, but over the last year, your day-to-day life has changed and you've lost other people that were close to you through death, those old coping skills may not be effective anymore, and finding some new ones may really be the key to coping with all of this.
As you've talked, I have thought about so many subsets of people who could benefit from this. But this really is something for everyone.
Absolutely.
I automatically went to pastors and leaders in churches and faith congregations as you talked, because a lot of times that's where we go. That's kind of our first contact when we're grieving, and what a resource this could be for them. But really, anyone is interested.
Absolutely, for anybody. I think it's so important to recognize one thing that's really impacted our grief and our ability to grieve and cope is that with the COVID restrictions, we weren't able to have funerals and memorials, and our grief rituals that we practiced as individual families or as community were interrupted. And we've seen that be a huge challenge for people because our normal grief work, we can't implement that, or we haven't been able to. Thankfully, we're getting around to some of that now. The other thing that's tremendously impacted people is not being able to be with their loved ones, especially in that 11th hour right before death. And so we see that there's been issues with closure and saying goodbye, and all of those are also rituals of grief that we participate in. Sometimes we don't realize that's what we're doing, but it really impacts our ability to grieve long term. And so some of those people that we're reaching out to, like you're talking about ministers or counselors or support people, lay people in our community, they're also grieving. So they don't maybe have as much to give right now. But COVID has been such a unique experience that maybe they don't know how to help. And this would be great for those people, but it's really great for anybody just to gain a better understanding of what we've been living through the last year.
It really is, and you handed me a sheet detailing some of the things about the program, and every time I glance down, I read a different word, and I'm like, yeah, that's so true, or that's really where we're at. So I would encourage everybody, even if it's for yourself or
Absolutely.
if you're a leader in the community. How does someone get access to the program? You said it's on demand. How does that work?
Right. So one of the things that's different this year is we usually have a screening or a viewing at hospice. So this year it's going to be a little bit different. So you will need to register for the program. You can do that by calling the Caldwell Hospice office, and you can put that number up, or you can do it through email at prc@caldwellhospice.org. But you will have to register by June the 4th. If you're a professional and have a professional license, there's several boards who are offering continuing education credits, and so you could discuss that too whenever you register if that's something that you need.
And if there's an organization that wants to register their employees, you can also discuss that whenever
Absolutely.
you register. So
Absolutely.
it is a good way to get those ever so important continuing education credits, which may have been more difficult during COVID.
It was a huge challenge. Absolutely.
As someone who needs those, Kimberly
Correct.
can tell us. Kimberly, I do have one more question, and this may or may not pertain to this. As we open up, how are people making that transition emotionally? Is it a relief for people, or there's some people still out there they're a little scared?
I think both. I think everyone is ready to change. I hesitate to say go back because I don't know that we will go back to life as we knew it anytime soon. But people are tired of being at home. They're tired of being restricted. They're ready to venture out, but there's still a level of concern. COVID is still a part of our lives. It's still present. We know it's still active. There are still people who are sick. Unfortunately, there are still people who are passing away from COVID. So there's still a concern there, and a valid concern. And so again, with any major life change, there's an adjustment that has to happen. And so even to loosen these restrictions and have more freedoms and the ability to go back out, and I think about, I've been watching some sporting events recently, and just seeing people out. People are still physically distancing, which is a great thing. We're still hesitant, and it's a change. We're probably going to have to learn how to re-socialize a little bit and be in each other's space again. I think about being out in restaurants, and we know that staffing is very low for some of those places, and so being patient with people and just sharing compassion with each other, I think, is really the key to that. But there's a lot of concern, and people are ready, but they're cautious, and I think that's wise, of course. But it will require some adjustment. It's different. We've been inside for a year, and so it is going to be a little challenging for a lot of people.
Kimberly, thank you for joining me today. Thank you for sharing about this great program that people have access to. Again, register before June 4th.
Correct.
By either calling Hospice at 754-0101, I believe.
Correct.
Okay, good deal. I got that right. Or registering at prc@caldwellhospice.org.
Correct.
Okay. All right, Kimberly, thank you.
Thank you for having me.
And thank you for watching Caldwell County Today.